health authorities and maritime logistics experts are shifting their focus toward a developing biosecurity challenge, as reports indicate a heightened risk of hantavirus transmission within international shipping corridors. The primary concern centers on the movement of rodent populations across oceanic trade routes, potentially introducing non-native viral strains into European port cities. Hantavirus represents a group of viruses primarily carried by rodents, including rats, mice, and voles. Unlike many other high-profile viral threats, hantaviruses are zoonotic, meaning they jump from animals to humans, but they generally do not spread through human-to-human contact. The concern for European infrastructure lies in the specific worst-case scenario, logistics. The unintentional transport of infected rodents in cargo containers, which then interface with densely populated urban centers near major maritime hubs. Understanding the threat requires a clear look at the virology involved. Hantaviruses are members of the Bunyavirales order. In the Americas, these viruses are often associated with hantavirus pulmonary syndrome, a severe respiratory illness, while in Europe and Asia, they more commonly manifest as hemorrhagic fever with Raynaud syndrome. Transmission typically occurs when humans inhale aerosolized particles of rodent urine, droppings, or saliva. In the enclosed environment of a shipping container or a large port warehouse, these particles can remain viable for several days depending on temperature and humidity levels. As global trade volumes remain high, the proximity of international vessel traffic to domestic wildlife populations creates a dual-threat environment where local rodent species may become reservoirs for imported viral variants. This framing is critical for public health reporting because it moves the conversation from localized rural outbreaks, where hantavirus is traditionally found, to industrial and urban settings. Authorities are now tasked with evaluating the efficacy of current pest control and quarantine protocols to ensure that crossing the ocean does not result in a sustained public health crisis. The focus remains on the intersection of global commerce and infectious disease surveillance, where the speed of modern logistics often outpaces the incubation period of the virus, making early detection a primary objective for border health agencies. The core of current developments involves a multi-agency response to secure the integrity of international trade hubs against biological contaminants. European health agencies, in coordination with maritime authorities, are reportedly reviewing sanitation standards for incoming cargo from regions where hantavirus is endemic. Laboratory settings and diagnostic clinics in major port cities are being placed on alert to recognize symptoms that might otherwise be dismissed as common seasonal respiratory infections or standard viral fevers. Because the initial presentation of hantavirus often includes non-specific symptoms such as fever, muscle aches, and fatigue, the clinical challenge is significant. Diagnostic accuracy relies heavily on serological testing to detect IgM and IgG antibodies or the use of polymerase chain reaction, commonly known as PCR, to identify viral RNA in the early stages of infection. In the context of European ports, the worst-case scenario involves a breakdown in the integrated pest management systems that are supposed to keep vessels and shipping containers rodent-free. Experts point out that while modern container ships are highly automated, the sheer scale of global shipping makes total exclusion of rodents a difficult target to hit. When a vessel arrives from across the ocean, it may carry stowaway rodents that have survived on organic cargo or waste. These rodents can then migrate into port facilities, potentially interacting with local species such as the bank vole or the brown rat. This cross-species interaction is a focal point for virologists studying viral spillover and genetic drift. Public health reporting notes that officials are particularly concerned with the dry ports, inland logistic hubs connected by rail to the coast, where cargo is opened and handled for the first time. The lab testing angle is also evolving, with a push for more rapid on-site screening tools that could be used by occupational health departments within the shipping industry. Currently, most verified data comes from hospital-based surveillance, which means a lag exists between the point of exposure and the official reporting of a case. There is a clear distinction between the alarmist claims often found in tabloid media and the measured, data-driven approach taken by organizations like the European Center for Disease Prevention and Control. While the headline of a global threat captures attention, the verified information suggests that the risk is manageable through rigorous adherence to international health regulations and standardized rodent-proofing of maritime infrastructure. Prevention and long-term surveillance form the final pillar of the global strategy against hantavirus expansion. Public health guidance emphasizes that the most effective way to prevent infection is the elimination of rodent habitats in areas where humans work and live. For port workers and those in the logistics sector, this means the use of professional-grade personal protective equipment, specifically N95 or higher-rated respirators, when cleaning or inspecting areas showing signs of rodent activity. Standard guidance dictates that instead of sweeping or vacuuming dry droppings, which can kick up the dangerous aerosols, workers should use a disinfectant solution to wet the area down, effectively neutralizing the viral particles before removal. Beyond individual protection, the limits of current knowledge remain an honest challenge for the scientific community. It is not yet fully understood how climate shifts and changing trade patterns might alter the traditional geographic boundaries of various hantavirus strains. Furthermore, the duration of viral viability in different types of industrial packaging is a subject of ongoing research. Surveillance programs are being expanded to include sentinel monitoring, where local rodent populations near ports are regularly trapped and tested to provide an early warning system before human cases emerge. This proactive approach is intended to transition public health from a reactive posture to one of active prevention. Hospitals and clinics are also being encouraged to take detailed travel and occupational histories from patients presenting with unexplained acute respiratory or renal distress. While there is no specific vaccine or cure for hantavirus currently available for general use in many regions, supportive care in an intensive care setting significantly improves the prognosis for those who are diagnosed early. The message from officials remains one of calm vigilance. The worst-case scenario is a possibility that is being actively mitigated through science and logistical discipline. As the international community continues to monitor these transit corridors, the priority is maintaining a transparent flow of information between port authorities, labs, and the public. This ensures that the global threat is met with a global, coordinated defense. For more updates on international health security and emerging biosecurity trends, consider subscribing to this channel. The current operational response to the threat of hantavirus in European maritime hubs involves a complex layer of interagency cooperation and rigorous biosecurity protocols. At the center of this effort are the port health authorities and the European Center for Disease Prevention and Control, which are monitoring the potential for viral introduction via international shipping lanes. The primary concern for logistics experts is the movement of the Sewol virus, a specific strain of hantavirus that is uniquely adapted to the brown rat, or Rattus norvegicus. Unlike other hantavirus strains that are limited to specific rural or forest habitats, the Sewol virus is globally distributed precisely because its host is a frequent stowaway on commercial vessels. When a ship docks after an oceanic crossing, the risk is not merely the arrival of the vessel itself, but the potential for infected rodents to disembark and integrate into local urban rat populations. This process, known in epidemiological circles as viral seeding, could lead to the establishment of the virus in previously unaffected metropolitan areas. To counter this, official statements from maritime regulators emphasize the strict enforcement of the international health regulations, which require ships to maintain valid ship sanitation control certificates. These documents verify that a vessel is free of rodents and other vectors, yet the sheer volume of global trade, millions of 20-foot equivalent units moving through ports like Rotterdam, Antwerp, and Hamburg, presents a significant challenge for 100% inspection rates. The diagnostic and laboratory angle is equally critical to the current surveillance landscape. Clinical facilities in proximity to major trade corridors are being briefed on the specific presentation of hemorrhagic fever with Raynaud syndrome, the primary disease associated with Old World hantaviruses. Laboratories are utilizing a two-tiered testing approach to confirm suspected cases. The first tier typically involves enzyme-linked immunosorbent assays, or ELISA, to detect the presence of IgM and IgG antibodies. If a sample returns a positive result, it is often followed by molecular testing using reverse transcription polymerase chain reaction to identify the specific viral RNA. This level of precision is necessary because the symptoms of hantavirus, sudden fever, intense headaches, and back pain, can mimic other common viral infections. In a laboratory setting, hantaviruses are handled with extreme caution because they are transmitted through aerosols. Certain strains require high-containment biosafety level 3 facilities to prevent accidental exposure to lab personnel. This technical requirement limits the number of facilities capable of performing definitive diagnostics, creating a potential bottleneck in the event of a large-scale outbreak near a major shipping hub. Furthermore, there is a clear distinction between the worst-case scenario headlines and the verified data provided by public health officials. While some reporting suggests an imminent oceanic crossing of a new plague, verified science indicates that hantavirus remains a zoonotic challenge rather than a transmissible human pandemic. The virus does not typically spread from person to person, which acts as a natural brake on its epidemic potential. However, the industrial environment of a port, characterized by large enclosed warehouses, grain silos, and complex piping systems, provides an ideal habitat for rodent reservoirs to thrive undisturbed. Authorities are currently focusing on environmental engineering within these zones. This includes the use of rodent-proof construction materials and the elimination of standing water and food sources that attract vermin. Trade and shipping organizations are also reviewing the cold chain logistics. While freezing temperatures can preserve some viruses, hantaviruses are sensitive to heat and certain detergents, meaning that routine disinfection of containers can be a highly effective, though labor-intensive, preventive measure. The current phase of the response remains one of heightened surveillance and infrastructure hardening, as officials weigh the economic necessity of fluid trade against the biological imperative of keeping non-native pathogens from gaining a foothold in European soil. The strategy for mitigating the hantavirus threat shifts from high-level port logistics to the practical application of public health guidance and the expansion of environmental surveillance. Prevention remains the primary line of defense, as there are currently no widely available vaccines or specific antiviral treatments for hantavirus infections approved in many Western jurisdictions. Public health agencies, including the Centers for Disease Control and Prevention and their international counterparts, emphasize that the most effective prevention is the rigorous elimination of rodent-to-human contact. This begins with the structural integrity of buildings and storage facilities. Practical takeaways for both industrial workers and the general public include the seal, trap, and clean method. This involves sealing entry points as small as 1/4 of an inch to prevent mice and rats from entering human habitats, using professional-grade traps rather than poisons that can lead to rodents dying in inaccessible areas, and maintaining strict food storage protocols. In a maritime or warehouse context, this means ensuring that palletized goods are kept off the floor and that waste management is handled with industrial precision to remove the attractants that draw rodent reservoirs into the proximity of workers. The methodology for cleaning areas contaminated by rodents is a critical point of public education. Health officials warn against dry sweeping or vacuuming rodent droppings, urine, or nesting materials, as these actions are the primary cause of viral aerosolization. When hantavirus-infected materials are disturbed, the virus can become airborne, where it is easily inhaled by unsuspecting individuals. The standard guidance for safe decontamination involves the use of a disinfectant solution, typically a mixture of 1 part bleach to 9 parts water, or a commercial-grade virucidal cleaner. The affected area must be thoroughly soaked for at least 5 minutes before being wiped down with paper towels or rags, which should then be disposed of in sealed bags. For those working in high-risk environments, such as holds of ships or long-term storage units, the use of personal protective equipment is non-negotiable. This includes N95 or P100 respirators, rubber or nitrile gloves, and protective eyewear to prevent mucous membrane exposure. These measures, while simple, are the most effective tools currently available to prevent a localized exposure from becoming a clinical case. Regarding the limits of current knowledge, the scientific community remains transparent about the variables that are still under investigation. One major area of uncertainty is the precise duration of viral viability in various industrial environments. While it is known that hantaviruses are enveloped viruses and therefore relatively fragile outside of a host, their survival time can be extended by high humidity and low temperatures, conditions often found in transoceanic shipping. Furthermore, the impact of global climate patterns on rodent migration and breeding cycles is a subject of intense study. As milder winters and changing rainfall patterns alter the availability of natural food sources, rodent populations may fluctuate more dramatically, leading to masting events that increase the likelihood of spillover into human populations. Surveillance efforts are adapting by using One Health models, which integrate veterinary, environmental, and human health data to predict where the next risk zone might emerge. This includes testing local wildlife near ports and transportation hubs to monitor for the introduction of non-native viral strains before they reach the human population. Ethically, the management of hantavirus at a global scale requires a delicate balance between economic fluidity and biological safety. There is a moral imperative for transparency among international trading partners. The failure to report rodent infestations or viral detections in cargo can have far-reaching consequences for the health systems of receiving nations. This reporting must be handled with a focus on public safety, rather than punitive measures that might discourage honesty in the logistics chain. As we conclude this report, the emphasis remains on informed vigilance rather than alarmism. By understanding the zoonotic nature of the virus and adhering to established sanitation and safety protocols, the global community can effectively manage the risks posed by these pathogens. The worst-case scenario is not an inevitability, but a prompt for better preparation, stronger infrastructure, and more robust scientific cooperation across borders. For continued coverage of global public health developments and emerging biosecurity